In this lecture, we're going to be discussing specifics pertaining to alcoholism and opiate dependence. In another lecture, I spoke about substance-related disorders and addiction in general, but in this particular lecture, we're going to be discussing specifics as they pertain to alcohol and opiate dependence. But before I continue, here is your dad joke of the day. Where do pirates get their hooks? At the second-hand shop. All right, let's get started. Alcohol, after caffeine, is the most widely consumed psychoactive drug and substance, and the most abused. People have been consuming some form of alcohol for thousands of years. Initially, they consumed it as mead, this awful tasting fermented substance, but beer and wine quickly became a replacement for mead as the way for people to consume alcohol. Beer and wine contain low levels of alcohol, and it wasn't until they distilled alcohol that has made it more concentrated did that actually lead to widespread abuse. So the only way that you can get things like hard liquor, such as vodka or whiskey, is through a distillation process that helps strengthen the potency, which is another word for the strength of a drug. The only way that you can increase potency is by distilling alcohol. And so unfortunately, because typically addiction is caused by drugs that have high potency, by distilling alcohol and making it more potent, it unfortunately led to greater abuse of alcohol. So I want to share with you a couple of types of alcohol. There are many different types of alcohol out there, but two that humans may come in contact with are ethyl alcohol or methyl alcohol. So ethyl alcohol, which is also known as ethanol, and you're looking at, I forgot to get my handy dandy pen. And you're looking at the abbreviation, it's sometimes abbreviated as ethanol in this way. It is the form of alcohol that is safe for human consumption, and it is the version of alcohol that is often found in beverages that people consume. Another type of alcohol is methyl alcohol, or methanol. It's also known as wood alcohol. It's typically used in things like antifreeze and other solvents that are used for industrial processes. It is highly toxic to humans. The reason why it's highly toxic is because when we consume methyl alcohol, it actually gets converted to substances that are typically used to embalm dead bodies, such as formaldehyde. And so it can generate the production of these substances, which essentially is going to cause you to, cause your cells to die. So the result of consuming methanol acutely, you can become blind, you can enter a coma, and you could even die. So it is good to avoid methyl alcohol and only stick to ethyl alcohol or ethanol, the kind of alcohol that's found in beverages. That is only if you're old enough. Unfortunately, with regard to alcohol, for those people who are chronic users, prolonged use of alcohol can produce physical dependence. It's one of those substances where, in addition to kind of changing your brain chemistry, it produces physical dependence. And so this becomes problematic because when people try to stop consuming alcohol following chronic use, they end up experiencing horrible, horrible physical withdrawal symptoms. How bad the withdrawal symptoms are typically are dictated by with the duration of the alcohol abuse and how much of the alcohol abuse, the alcohol you consumed while you were abusing it. But here are some typical withdrawal symptoms that people can expect to experience when they are trying to stop consuming alcohol if they have been chronic users of it. So they might experience tremors, anxiety, cardiovascular increases in heart rate as well as blood pressure, sweating, rapid breathing, as well as nausea and vomiting. You'll notice that all these withdrawal symptoms represent excitability of the nervous system, right? That the nervous system is hyperactive in the absence of alcohol. If you did not watch the lecture on substance abuse or substance-related disorders, in that lecture I discussed the relationship between tolerance and withdrawal. As tolerance develops, it increases the likelihood of withdrawal symptoms, and typically the withdrawal symptoms are the opposite effects of the drug. And the reason why is tolerance is caused by the body trying to compensate and override the actions of the drug itself. Alcohol is a sedative. It inhibits the nervous system, and so to maintain homeostasis, the nervous system is going to counteract the effects of alcohol by trying to change the cells to make them hyperactive. And so in the absence of alcohol, we end up with those hyperactive changes showing up as withdrawal symptoms. One of the most dangerous withdrawal symptoms from alcohol, and this happens with like severe alcoholism, is something called delirium tremens. It can produce things like hallucinations, seizures, disorientation, panic attacks, and even unstable blood pressure. It is often recommended that for folks who are trying to stop alcohol use after chronic use, that they do it under the guidance of some sort of medical supervision, simply because it could potentially be dangerous to withdraw from alcohol. One of the consequences of chronic alcohol use is something called Wernicke-Korsakoff syndrome. This particular syndrome appears or seems like it's similar to dementia, but it's not, because it's caused solely by chronic alcohol use. So Wernicke-Korsakoff syndrome is characterized by confusion, disorientation. The person may experience tremors as well as poor coordination and not really know where they are. Wernicke-Korsakoff syndrome is caused by massive cell loss in the brain. So hundreds, if not thousands, of neurons have died as a result of chronic alcohol use over time. It can only happen with chronic alcohol use. And so what's happening is that when people consume alcohol, they are creating a scenario where their their digestive system is unable to absorb thiamine or vitamin B1 from their diet. Unfortunately, when thiamine is not available for use, glucose, which is the sole source of energy for the brain, cannot be broken down into a usable form by neurons. As a result, the neurons end up starving and therefore dying. So the thiamine is necessary for glucose metabolism and ultimately the survival of neurons. And in the absence of that absorption of thiamine, the brain essentially starves and dies. This is solely because of alcohol use. Alcohol prevents the absorption of vitamin B1 from the digestive system. If you stop consuming alcohol, you can stop the degradation of neurons, so they will stop dying, but you can't reverse it, meaning we can't get back those neurons that were already lost from the result of chronic alcohol abuse. To illustrate the kind of loss that occurs with Wernicke-Korsakoff syndrome, on the left here, here you're looking at the CT scan of an alcoholic brain, and here's what the brain of somebody who doesn't consume alcohol looks like. You'll notice these widened spaces called ventricles that are much, much larger in the alcoholic brain compared to the control brain. The only way these ventricles can get larger is if someplace else in the brain shrunk. And if we look down here, this is a computerized image scan of the cortex. So this is the nose, where the nose would be, this is the back of the head, and these are the sides of the head. So we're looking at the brain from the top down. And you'll notice that a lot of these convolutions that are supposed to be thick and fat have shriveled up and shrunk so much that we can actually see through the middle division in the brain. You can't see that in the control brain because there isn't as much cell loss. So there's massive cell loss in the brain of a chronic alcoholic, entirely caused by the inability to absorb vitamin B1. So alcoholism, like all drug abuse, is not simply explained by one factor. It's likely there's a combination of factors that together influence the risk for alcoholism. But because we have a complex interplay of factors contributing to alcoholism, it often makes it difficult to define. How do we know when somebody's actually having a problem with alcoholism versus not? You might say you know what it looks like, but where is that cutoff? And then if you have trouble defining it, how do you end up treating it? So as I mentioned, a variety of factors contribute to the risk for somebody developing alcoholism. Genetics and family background certainly contributes to the development of alcoholism. It seems that there's a genetic risk for some individuals in particular for developing alcoholism, and we'll talk about this later, but there's two types of alcoholism. One is called early onset and one is called late onset. The risk or the genetic influence for alcoholism is greater in the early onset alcoholism than in the late onset alcoholism. Additionally, we know that alcoholism tends to run in families, so there has to be some sort of genetic risk, but it doesn't seem to be that any one particular gene is likely contributing to alcoholism risk. There's likely multiple genes. What's interesting is that we know of one situation where having a particular genetic makeup protects you from alcoholism. So some individuals are missing a gene that helps break alcohol down, and because they are missing this gene, they don't break alcohol down in the same way that we do. Instead, the pathway to break down alcohol kind of gets stuck in at one part. So it's a multi-step process to break down alcohol, but it gets stuck at one of these steps, and the product of that particular step it can be toxic for individuals, not to the point where it kills them, but it makes them feel really uncomfortable and nauseous. So they might end up experiencing flushing and hot and uncomfortable. And this is caused solely by the absence of a gene that's important for breaking down alcohol. This particular gene, this mutation of this gene, is common in the Asian population. And so when people who are missing this gene consume alcohol, they might find that they never want to touch it again. So missing this gene appears to be protective to prevent people from developing alcoholism. Alcoholism also is dependent on the environment. In cultures, where alcohol is seen as a way to celebrate, as a way to drown your sorrows, those cultures are more likely to have higher incidences of alcohol abuse. So, for example, in the Italian and Irish cultures, alcohol consumption is seen as a normal feature of one's day, and you're more likely to see higher rates of alcoholism in those cultures than others where alcohol consumption is not acceptable, like in the Muslim faith, for example. What psychologists have noticed is that regardless of cultural differences, in individuals who have been raised in families that have lots of conflict, hostility, or there seems to be an absence of parental supervision, those individuals are at greater risk for developing alcoholism. Another way to kind of tell whether somebody has a predisposition to alcoholism is how they react to the first drink they have. We all have different levels of tolerance, like naturally, even before we experience a particular substance. And there are people who the first time they consume alcohol require greater amounts of alcohol to feel drunk or to feel the effects of alcohol. Those individuals are more likely than average to become heavy drinkers and develop alcoholism. So individuals that seem to have a naturally high tolerance for alcohol, even before they consume it, are more likely to become alcoholics. So what can people do if they are suffering from alcoholism? Interestingly, many people try to quit on their own, understandably, but only 10 to 20% of people who attempt to quit on their own actually are successful in quitting. So for those 80 or 90% who are not successful on their own, there's Alcoholics Anonymous. It has been around for decades, and it is a self-help group that people attend to encourage abstinence from alcohol use. Typically, people who are part of AA are also recovering alcoholics themselves. There is an acceptance of the idea that they are not in control. They give themselves up to a higher power. If you're unfamiliar with AA, it follows what's called a 12-step program, so that's really popular or well known. But typically people who join AA are only give their first names, they introduce themselves, and they're typically offered a mentor, somebody who's going to check in on them to make sure that they're doing okay, especially when things get especially difficult for them. The other feature of Alcoholics Anonymous is that it rewards abstinence, so people end up getting chips to recognize the amount of time that they have remained abstained, or that they've abstained from alcohol. There is a medicine out there that somebody can take to help facilitate giving up alcohol. The drug is called antabuse. Antabuse blocks the same pathway that breaks alcohol down, making people in the Asian population get nauseous. Antabuse works the same way. It blocks that pathway, making people nauseous, which is why they become sick if they attempt to have a drink while they are trying to quit. Another feature of treating alcohol, or any substance abuse for that matter, is something called contingency management. Contingency management actually comes from the learning field. What you're doing with contingency management is the person who's abstaining from alcohol receives some sort of immediate reinforcement, typically from a therapist or somebody that they're working with, or they can even give it to themselves, but that's less effective. So, but it revolves around the idea that people are getting rewarded or reinforced for abstaining from alcohol. I'd referred to this earlier, but I wanted to be more clear and review it. There are two types of alcoholisms out there. One is more severe than others. I referred to one of them as early onset, and that was the type 2 or type B. Don't ask me why they labeled the worst one as the second one, but they did. But type 1 and type 2, or type A and type B, vary in their severity, gender distribution, genetic basis, as well as onset. So type 1 appears to be less severe, has a better outcome when people try to quit. It seems to affect both males and females equally. There doesn't seem to be a strong genetic contribution for type 1 the way there is with type 2, and you're likely to see the onset or the development of type 1 later in life, typically adulthood. Type 2, on the other hand, is more severe and can be associated with certain behaviors or personality types. It seems to be almost exclusively in males, and there's a strong genetic contribution for type 2. And it is the type that occurs much earlier in life, typically teens or early 20s. So type 2 is the worst of the two types of alcoholism, simply because there's a genetic risk and it affects individuals earlier in life. We're now going to transition to opiate dependence. So what you're looking at here is a poppy plant, and this is the base of the poppy plant. By kind of cutting it or putting a slice through it, the sap that comes out of the poppy plant contains substances known as opiates. So this is opium, and initially, before chemistry getting better, people used to smoke this sap to feel the effects of opium. Prior to the 1900s, though, opiate drugs like morphine and heroin were considered much less dangerous than alcohol. Everyone knew that alcohol was this insidious substance and people should stay away from it, and it is kind of the the substance that's going to ruin families and ruin lives. And many doctors at the time recommended that people replace alcohol with opiates instead. In fact, opiates, prior to the 1900s, opiates were available as over-the-counter substances. What you're looking at here are ads for tinctures or solutions that contained opium, and people could just order these, mail order these and receive them. So here's a medication used to treat children or adults. And so opiate use was seen as perfectly acceptable, whereas alcohol use was seen as more dangerous. We now know that's not the case. So many doctors, as I mentioned earlier, used to encourage their patients to switch from alcohol and use morphine instead, only to learn that they became just as addicted, if not more addicted to morphine than alcohol. But around the 1900s, opiates were kind of overseen by the government. They became illegal to use over the counter or recreationally, except to treat medical pain or pain medically. But one thing to keep in mind is that opiate dependence is way, way worse than alcoholism. It has a much more rapid onset than either alcohol or tobacco. So that's nicotine. People need to take less of the opiates for a less amount of time before they become addicted to it. And what's worse is that it's much easier to have an overdose with opiates than it is for alcohol and tobacco. So really, opiates are a much more dangerous drug compared to other substances that people might use recreationally. So what you're looking at here is from the 2000 till 2014, the number of deaths by opiates per 100,000 people. So most of these were overdoses. This is overall drug use involving opiates. And then down here, these lines are broken down by natural, synthetic, methadone, and heroin overdose. You'll notice the gradual increase in overdose death by opiates. And there's lots of reasons to explain it. As people use opiates more, you develop huge tolerance for opiates. And so as people increase their doses, there's some conditioning involved where they might end up using a higher dose in environments where they typically don't use it, leading to overdose. The other contributing factor to overdoses is that people may not know how much opiates they're actually getting in the pills or the substances or powders that they purchase, right? These are not regulated substances. And so it's really easy to overdose on opiates because it doesn't take much to kill somebody. The way opiates cause an overdose is they act in the brain to stop breathing. So the person's actually suffocating, and it's one of the reasons why an indicator of overdose is the person's lips turn blue, is because they are not breathing. They're not consuming oxygen. And so the only surefire way to counteract an overdose is by squirting Narcan into the nasal passages, which competes with the opiates in the brain and prevents opiates from continuing to work in the brain. So just to give you an idea of how easy it is to overdose with opiates, and again, 2014 is kind of old. This was prior to the prevalent use of fentanyl. Fentanyl was around, but it wasn't as easily available as it is now. So what you're looking at here are 2 jars containing the amount of heroin and fentanyl it would take to cause an overdose. And so it is not much. What you're looking at with fentanyl is it's just, tiny, tiny granules of the drug. What's more is that if you have something that is laced with fentanyl, you typically don't consume fentanyl or opiates, it's likely going to kill you because it's not going to take much to overdose on fentanyl. This map down here illustrates the overdose deaths in 2015 per 100,000. The more red you see, the higher the number per 100,000. And you'll notice that opiate overdose is very concentrated on certain regions of the United States. These are by counties. And so certain counties seem to be more, at risk for opiate dependence and therefore opiate overdoses than others, just to illustrate that we are truly in an epidemic of opiate overdose or opiate dependence. And just to highlight the fact that this was in 2015, so by now it's likely that these numbers are more widespread, if not higher. So like alcohol, heroin, or withdrawal from opiates causes physical dependence, and heroin withdrawal is miserable. They equate it to the equivalent of a horrible, horrible flu where you have aches, chills, joint pain, goosebumps, and so it's just miserable. And typically, because people are miserable withdrawing from heroin, they are more likely to go back to using their substance to stop the withdrawal symptoms. And so it's often encouraged that heroin withdrawal occurs in a facility to ensure that people remain clean, simply because the misery associated with withdrawal typically causes the person to go back to using heroin or their opiate of choice. What's more is that even after detox, even after the system is cleared of opiates, the intensity of craving continues. So even after, weeks of detox, people can still experience craving, intense craving for heroin and withdrawal. So it's just not the best drug to become addicted to. Not that I recommend addiction to any substance, but just even playing around with opiates is playing with fire. To treat opiates can be similar to what you have with alcohol. There's actually self-help groups called Narcotics Anonymous, or NA. People who they've formed NA to be similar to AA. You can also use contingency management as well as other treatments. For those who really have difficulty quitting, they can be prescribed something called methadone. So unlike antabuse, which is not alcohol and actually blocks the metabolism or breakdown of alcohol, methadone is an opiate. What methadone helps people who are withdrawing from opiates do is make the withdrawal symptoms less intense, less severe, and decreases craving for opiates, which is what's likely going to drive them to return back to opiate abuse. You should know that methadone is an opiate, and so if it's consumed any way other than orally, it can also become addictive. So just to illustrate, we're comparing morphine, methadone by injection, and methadone typically how it's prescribed orally when we're using it to help with opiate dependence. Morphine is addictive. The onset of addiction can be rapid. They can experience a high, it can relieve cravings and reduce withdrawal symptoms. So can methadone by injection. So morphine and methadone by injection are nearly identical. What makes methadone different is when it's consumed orally, it is less addictive and it helps with the craving and withdrawal of the person trying to quit. So you can be prescribed methadone and then slowly over weeks prescribed fewer or a lower dose of methadone, ultimately coming completely off methadone. So methadone is often a way for people to quit their opiate dependence, but you could potentially develop an addiction to methadone as well. So here's the summary for this lecture. We talked about alcohol as well as opiates and features of addiction associated with each of these two types of substances. And here are your exit ticket questions.